you're back in this whole problem with insurance. Here's the list of covered services. You're going to get every single one of those tests, whether you need it or not. As a doctor, if you do not order every one of those, you're going to get a knock on the door like I did from, hospital administrators going, you're not keeping up with your billing.
Welcome to Unconventional Medicine. I am your host, Brendan Cochran, molecular biologist. I am joined by my co-host, Dr. Jason. Jason is a registered clinical pharmacist with expertise in immunology and organ transplantation. And today we've got a special guest. Dr. New has over 30 years experience in integrative medicine, 25 years in emergency medicine. He's a fellow at the American Academy of Anti-Aging Medicine, A4M. He has been a Defeat Autism Now practitioner for over 2 decades, executive board member of Medical Academy Pediatric Special Needs, or MAPS. He lectures on a range of topics, including immune system disorders, detoxification, complex chronic illness, including Lyme disease, autism, ADHD, and allergies, and he likes boating. So, Dr. New, welcome, and thank you for coming on.
Well, thanks for having me. It's a pleasure to be here.
I'm gonna kick it off because your journey, although not identical to mine, but is similar in the sense that you went down this path of traditional Western medicine training. You went to a prestigious university. You were a surgical resident, experienced in emergency medicine. Tell me this story, because I'm often fascinated by someone that, because when you go down this road of medical training, you don't know it, but you're becoming indoctrinated to certain thoughts, right? And how do you see outside of that? For me, it took me 2 years to kind of have that epiphany.
Yeah.
When and how did your epiphany come?
I actually went to medical school because I wanted to learn how to heal people, and they don't really teach you that in medical school. And you're right, you get indoctrinated. It's men and women, but it's a big boys club. And at some point I went into surgery because it was, I was actually very interested in immunology. I thought I was going to become an immunologist. That's what I thought I was going to do. But I went into surgery, A, because I was good at it, and B, because you actually remove disease from the body. So going back to the how do you cure people, that was as close as I could get in medicine. But, halfway through my surgery residency, sort of woke up in terms of, there's this whole world out there of medicine that I didn't know anything about. And that got me learning things like herbal medicine and nutrition and homeopathy, acupuncture, those kinds of things. And that's what actually got me to leave the mainstream and start setting up my practice. So it was always looking at, what's the root cause? What's causing the problem? Why is this patient ill? And, you don't have to have too many patients wake up from an operation after you've taken out half of their colon because they have colon cancer. The first question any intelligent human being's going to ask is, what do I do so this doesn't come back? And I didn't have an answer to that. I mean, they did not teach me that in medical school. And so that's part of what got me on this journey. And it's, again, this is back in the 80s. There just wasn't a lot of formal education in integrative medicine. So it was mainly, even there wasn't an internet. So, it was mainly working with other people that had that expertise and learning through internship with an herbalist, with a homeopath, and I took a formal acupuncture course. But that's really what I started with. And everything else has been driven by what my patients need, right? Somebody comes in and, I always say they tell me their tale of woe, and I try to figure out what's wrong with them. And by jumping down those rabbit holes, that's where you start saying, oh, I need to learn more about, mitochondrial function. I need to learn more about cell danger response, or I need to learn more about toxicity and heavy metals and all these things they don't teach you about in medical school. So that's really how I got here. And then, the whole autism thing, I was well into my practice. I mean, I had well-established practice, and it was actually my wife that dragged me into this whole world in the mid-2000s, like 2005, 2006, something like that, where a friend of hers had a kid on the spectrum, and, she had asked, how's your son doing? And her friend said, oh, he's cured. And she thought, whoa, I didn't know you could cure psychiatric disorders like autism. asked her what she had done, and it's like, oh, we did B12 shots and
Hmm.
detoxification and chelation. And it's like, well, New does all that stuff. And she came home and sort of said, honey, we're saving the babies, and dragged me kicking and screaming into that world. But I mean, that's been sort of the most rewarding thing. And what we're trying to do with Medical Academy Pediatric Special Needs MAPS, which I'm now the president of MAPS for the past 2-3 years, but what we're trying to do is give an avenue for people to get into this world without necessarily having to blow everything else up. We're trying to offer a path for people to learn integrative medicine. I mean, as it
Are
applies.
you talking about physicians? Like, is that when you talk
Well,
about people, are you talking about other
practitioners.
healthcare professionals?
Yeah,
Practitioners. Okay.
practitioners. Oh, it's MDs, DOs, chiropractors, nurse practitioners, PAs, I said chiropractors, the nutritionists, anybody.
Yeah.
I always say, if you got, a certificate on your wall and you see kids in your practice, you want to be part of MAPS.
You made the leap, and what was the first thing you dove into? Talking about rabbit holes, like what
Yeah, right.
what
Well,
was like, okay, this is very interesting to me. What was that first thing?
Yeah, so really the first thing was, you hang on a shingle and the first thing you see are people that just have these chronic health conditions. And,
Yes.
in mainstream medicine, these are your nightmare patients, because when they walk in the door, you're not going to be able to help them. There's no drug that's going to fix what's wrong with them, no operation or whatever.
Mm.
And so that's really what got me. I think the first rabbit hole was probably toxicity, because I remember the first integrative conference I ever went to was chelation therapy. And again, this is back in the late 80s, when they were going after doctors that were doing chelation. They had just had a couple of landmark cases that said, this is why we can prescribe stuff off label. Is a lot of that had to do with those chelation cases. And so I that was one of the first things I learned. And then it's like, oh, well, when you detox some of these patients who are chronically ill, they get better. Right. And that
Mhm.
was, sort of got me rolling. And then, nutrition became a big part of it, because again, in medical school, they don't teach you much about nutrition. My nutrition education was, if you don't have enough vitamin C, you get scurvy. If you don't have
Right.
vitamin D, you get
Right.
rickets. It wasn't about
Right.
ideal levels
It
of anything. It
it
was just, this is the disease caused by
it
the
was
lack.
like so lackluster. Even when I was going through pharmacy school, there was I probably could fit 1 hour's worth
Yep.
of knowledge on supplements and herbs taught at a doctorate level of pharmacy program. They didn't
Right.
cover it. I think they're doing a better job now, but not really. Really, not really.
Yeah, I think they give it more lip service, but honestly, I don't know how much they're doing. And part of the issue with the whole nutrition side of things too is, I mean,
Mm.
if you've looked into that literature, it really has been corrupted by the industry. So much of the nutritional, the papers that were published, are heavily influenced by industry. So you have Nestle sponsoring nutritional studies on, the benefits
Yeah.
of sugar. It's
Yeah.
like, well,
Yeah.
there might be a conflict there somewhere.
A little bit,
Yeah.
And Brendan and I just did a podcast on that. Just the other day, it's about to get published. So we're
Yeah.
right there with you.
Yeah, my joke these days is, if you want to do a literature review type study, a systematic review of the literature on nutrition, and just exclude all the articles that were funded by industry, it would be a very easy thing to do, because there's probably
Yeah.
6 or 8 articles you need to
Yeah.
read.
Yeah,
Right.
it's a very
Yeah.
thin journal.
A meta study
Doesn't
done on things that don't compete with industry. I agree with that.
Yeah,
So-
it's just incredible.
So let me ask you a question about. So we're talking about nutrition. We're talking about heavy metals and toxicants. So what do you think the major drivers are for disease? If you had to pin them down to just a handful of these things, what do you see?
Well, I mean, I honestly believe that the majority of what we're looking at is some type of toxicity on a system that is unable to detox. Now, that inability to detoxification pathways, that could be genetic. There's all kinds
Yep.
of genetics that are involved with the people that I see. but it's also, you know, a nutritional deficiency. And, you know, part of the issue is some of the toxicity is coming from the foods that people are eating. So it's not, you know,
Right.
people are always looking at, well, how could I have this? You know, I live in this nice neighborhood. We're nowhere near
Mm,
industry. You know, I drink the
Right.
filtered water and all
No,
that's like
no
lots of
aluminum smelters down the street.
right. So, you know, people don't understand how toxic food has become
Yeah.
because of what they're adding to foods. And so, you know, again, if somebody comes in the door, I mean, the first thing we're going to talk about is, you know, what are you eating?
Yeah.
And you just need to get rid of anything that's processed. I mean, if it doesn't look like the way nature gave it to you, then don't eat it. You know, unless you changed it yourself and you know exactly what's
yeah.
in there, because they add so many things. But I mean, to me, that's what it is. It's toxicity that's affecting a system that's unable to detoxify, right? So it could be a little bit of toxicity on a really weak system, or it could be a whole lot of toxicity on an average system. But either way, you're going to end up with a deficit. That's going to then create the kinds of, you know, the kinds of things we see. And one of the big things that happen initially, it screws up the gut ecosystem and it
Yeah.
screws up mitochondrial function. And without those two things, nothing works, right? You know, I have brain fog, I'm losing my memory, and I'm bloated, I can't lose weight, I feel tired all the time, I can't sleep. And it's like, you don't have six different problems. You know, you have one or two fundamental issues that are
Mm.
driving everything else. And that's part of, you know, this whole idea of, you know, getting to root causes and figuring out how to heal from inside out. You know, and again, you know, I deal with kids on the autism spectrum. You can do a lot just by getting these kids to eat real food.
Right. Yeah. And speaking of autism, I looked up some statistics. So this is just since 2000. And I'm sure you know these stats probably better than anyone. There's a 300% increase in autism. So now we have a 1 in 36 children with autism. I mean, this is off the charts. Like when I was a kid, I don't even really remember this being an
Well,
issue at all. I don't think there was anybody in my school that had it.
yeah, I'll give you even bigger, mind blowing number. All right. When I went to medical school in 1981, the rate of autism was somewhere between 1 in 5,000, 1 in 10,000. We don't really know the numbers because they weren't tracking them that well, but that's the guesstimate, you know, 1 in 10,000. That they're now 1 in 36. So if you want a
Yeah.
percentage increase, that's 28,000% increase
Right.
since I started medical school. When I went to medical school, and this is University of Michigan, you know, both as a student and then as a resident, I didn't see a single case of autism. Now, you know, you can't go to a grocery store without seeing a kid on the spectrum. You can't go to a ball game without seeing a kid on the spectrum. They're everywhere. And that 1 in 36 number, it's really important that people understand this. Since 1992, every 2 years, they have certain centers in the country that they coalesce the data, and then they determine what was the rate of autism for that year. So every year, 1992 and on, they've had it. That 1 in 36 number, that's from 2020. So they have
Mhm.
not given
Right.
us new numbers in 4 years. And
Mm.
they are giving us numbers for 8-year-olds. So those numbers are from 2020 with kids that were born in 2012.
Oh,
So if
that's interesting.
anybody
So that's
asks
just 8-year-olds?
8-year-olds, yeah.
Oh, for
So
heaven's
it's
sake.
only
Okay.
8-year-olds. So
Yep.
those are, you know, we call it a birth cohort, right? That is the 2012 birth cohort. That is, I mean, that's 12 years old, right? So if
Yeah.
somebody says, what is the current rate of autism? The correct answer should be, I have no idea,
Oh, no. Yeah, right.
right? I have no idea. Because if you follow the curve, that 1 in 36, you know, if you just draw a line and follow the curve,
Right.
right now for a kid born today, it's probably 1 in 15.
Wow.
I mean, it's just obscene. And that's all kids. Remember, boys are 4-1 over girls. So if you're
Right.
talking boys, that 1 in 36 was 1 in 22. And if you're talking African-American boys, because they have a higher rate, it's not 1 in 22. It's around 1 in 12 or 13.
What
So
about
those
what
are,
about the argument that we just weren't tracking it right? Like these kids, we had these rates previously, but you know, we just didn't have the right metrics in place.
yeah. Well, I mean, anybody that has, that's been around for a while. I mean, number one, my quick answer to that is I'm 64 years old. Show me the 1 in 36, 64-year-olds that have autism.
Right.
Okay. I mean,
Right.
right there,
Yeah.
right there. That kills the argument right there. I don't know anybody my age that has autism. and even if you throw in Asperger's and call it autism, even with that, you're not going to find 1 in
Yeah, you're not
36.
getting
Okay.
these numbers.
So, I
No.
mean, that argument falls
Mm.
down right there. Anybody that's practiced medicine for more than 20 years knows that. The other thing is, anybody that's been on the planet for a while knows that, because you can go back to your childhood. I went to a high school with 1,500 kids. We had a special ed room. I knew all the kids in the special ed room. None of them had
Right.
autism, right? They
Right.
had Down syndrome, they had
Mhm.
cerebral palsy, those kinds of things, but nobody had autism. So I mean, that argument really falls apart. Some of the increase is from better diagnosis, where we're clustering people that, I know, again, according to my, sort of true impression of what autism is, because they've changed the diagnostic criteria over time. So some of the increases from that, but it might be 20-25% at most. And
Right.
remember,
Right.
if we're talking what did I say, 28,000% increase, come on. Really? That's from better diagnosis? I always say I need to go back to U of M and get my money back because they didn't teach me how to diagnose.
Right.
I've just
Right.
that many cases of autism. Right. So,
So if you have somebody who comes into your practice, and I think I want to probably put this out there for the viewers who don't have access to physicians who think like you do, who are alternative and get to the root cause of things. So what kinds of like panels where should they start with a physician like that? What should they be asking for?
yeah, I mean, first of all, there are a number
Or
of
where do you
organizations.
begin?
Yeah, I mean, there are a number of organizations that, for physicians like myself, again, the Medical Academy, Pediatric Special Needs, it's medmaps.org is our website, but we keep a list of all practitioners. And, part of my sort of charge is to increase the number of doctors that have been through our program and that are trained. I mean, there should be a MAPS doctor in every community. You
Agreed.
shouldn't have to travel to go see a MAPS doctor. So, but there are other organizations, people like A4M, the American Academy of Anti-Aging Medicine. I'm a member of that group. You've got other integrative groups out there. The key, they have lists of physicians, and some of them are very integrative and some of them are not. But you can find somebody that is doing the work that you're interested in doing. What I start with is, I mean, first of all, you can get data off of basic blood work. I mean, people don't realize that there is a great degree of benefit to some of that stuff, but you have to look at it from the perspective of what's ideal, right? So, if you look at something like, a blood sugar level. So, blood
Mhm.
sugar level, normal range is maybe 65 to 100. Ideal is 60 to 80 or 70 to 90. So that's your ideal range, right? It's the same with thyroid. When they say your TSH, it's a thyroid number, the normal range is from 0.35 up to maybe 5 or 5.5. Well, first of all, if you just look at it logically, percentage wise, that's like saying the normal blood sugar isn't from 65 to 100. It's from 60 to 900. I mean, those are so
Yeah.
right out of the gate, you go, whoa, that's a little wide for a normal range. But when you look at people that are ideal health, and they've done these studies for adults, 25 to 30 years old, ideal health, ideal body weight, no allergies, no family history, no supplements, and no symptoms, good energy, all that stuff. You look at their TSH, it's never over 2, and it's almost never
Yeah.
over 1.
Yeah.
So what's a normal TSH? Is 5 normal, or should it be more like 0.8, right? So even normal blood work can help you. We do things like organic acid testing. This is a urine test that looks at organic acids that are either manufactured by gut bacteria or yeast, but also acids that tell you about nutrition. Because again, you want to know what your B12 level is? Well, you can do a blood level of B12, but we don't really use B12 in the blood. And we know with kids on the spectrum, they have trouble transporting B12 and
Mm.
transporting folate. So they could have normal or even high levels of B12 and folate in their blood, but it's low in their brain because they can't transport it. So organic acids can tell you about those. So for example, you need B12 to recycle methylmalonic acid.
Mhm.
So you can measure methylmalonic acid in the urine or in the blood. If there's not enough B12, that level goes up. And again, not normal, but ideal. What are those ideal levels? And by doing that, there's, markers for B12, folate, B6, B2, B1. There's all kinds of organic acids that can tell you about that, right? And then obviously the products of metabolism, the mitochondrial intermediates, those are all organic acids, and you can measure those in the urine. So we get an idea of somebody's health based on that. And I mean, that's a whole, residency in and of itself, how to interpret an organic acid profile. But it's one of those things that I find to be very, very helpful. Anybody that's chronically ill, that's where I start. I'll look at the labs they've had done, because nobody comes to my office and I'm the first doctor they've seen, right? I mean, usually I've seen 15, 20 other doctors. So, and even a lot of integrative doctors, just because I've been in practice for so long. But they'll come in with the outside labs, but then I'll look at an organic acid test. And depending on what that looks like, because that can give me an idea of, are they toxic or not? What does their brain chemistry look like?
One of the things, sorry, Dr. I was just going to echo that. One of the things I learned in going through my clinical experience and my many years of training is to never rely solely on the labs. We're not treating the lab work. We're not treating the level. We're treating the patient.
Yep.
And I think that's what you're essentially saying is
the
labs are important, right? But what's going on with the patient?
Yeah. I mean, I trained at a time, and this got me into trouble in the ER, but I trained at a time where, University of Michigan, I think, had 2 CAT scanners. MRIs had not been invented yet. And the CAT scanners were used for research as well. And I remember, 1 or 2 o'clock in the morning, taking an anesthetized pig off the gantry of the CAT scanner to put my patient on it because I needed an emergent CAT scan. So that's how old I am. All right. So when I trained, the saying was, if you don't know what's wrong with your patient by the end of your interview, then either you're not going to learn about it, or you're going to have to do some digging to figure it out. So the saying was, the history is for the diagnosis, the physical is to confirm the history, and the labs are for the lawyers. I mean, that's what I was taught. And so it got me into trouble in the ER because, I would have these hospital administrators come down and say, "Oh, Dr. New, you're not ordering as many CAT scans as your colleagues." And it's like, am I missing things? Am I sending patients home undiagnosed? Am I wrong? Is my diagnostic percentage off? Oh no, you're our best diagnostician. Blah blah blah. It's just you don't order as many CAT scans as your colleagues. I can't help it if they don't know how to diagnose.
Yeah,
but it's really to confirm. Usually I sit down with somebody. And, I call it their tale of woe, right? So they'll tell me their tale of woe, and I'll have a pretty good idea of what's going on. And I'll do the labs to confirm that. And also the other thing the labs do for me, and it really gets people on board. So if I'm going to tell somebody, I want you to do a gluten-free diet, or I want you to do a dairy-free diet, it helps to have a food sensitivity panel that shows that gluten's lighting up, right? Or something, a genetic panel that says they have one of the risk genes for gluten. But it enrolls patients. I don't necessarily have to do that. And certainly when I see patients where, finances are a big issue because you're paying out of pocket for all these tests, so we can certainly try and dial those back and treat based on symptoms and do, the therapeutic trial where, I think you have a cerebral folate deficiency, or your kid has this. Let's put them on high doses of leucovorin and see how they do. Because in 3 or 4 weeks, it makes a difference for them. Right.
Yeah.
And so, but to me, it really is labs are for the lawyers, because, I've become a target and I really want to have some foundation for what I'm doing. I mean, not for me, but if somebody starts questioning what I'm doing.
I mean, medicine is very much a litigious atmosphere, right? So
Absolutely.
especially as an ER physician, right? So you're kind of like ground zero. They come in to see you, and you got to start from scratch. And if you miss something, God forbid, it's all on you. So it's the way insurance, this is a whole nother podcast, but it's the way insurance is structured. It's the way we make money in this industry.
No, I think the worst thing that ever happened to medicine was health insurance. It's one thing to have health insurance for disasters, for you're in a car accident, or you need, some major surgery or something
Catastrophic.
Right.
Yeah.
Yeah.
But the worst thing that ever happened was to have insurance that covered office visits and that sort of thing. And even medications. I mean, most of the medications we use wouldn't be on the market if people actually had to pay cash for them because nobody would pay for it.
Mm.
Right. Yeah, right. I was going to say some of the panels that you're requesting so that you can do this deep dive and this, that's not covered by insurance. There's no doubt about that.
No, but I mean, just as an example, an organic acid test these days is
That's cheap,
maybe $400,
relatively. Yeah.
$500, something like that. So not that that's, pocket change, but it's also not $1,000,000. I mean, if
Right.
I remember going to a lab and having a hormone panel done along with some, cholesterol panel and blood count and that sort of stuff. It was $885 is what they charged my insurance company. Now
Yeah.
I know because I have a lab that we use that does standard stuff. It's all cash. And I know that same panel at my cash lab's around $130. So
Right.
that's the difference between insurance and cash. And the lab I deal with, they're still in business. They're making money at that
Right.
$130 price point, right? So
I wanted to share with you a quote. This is from, we sort of talked about this a little bit, Dr. Scott Jensen. So he put up a post just the other day. Of course, he's not only is he an MD, but he's a politician out there in Minnesota. Dear patient, believe it or not, I get paid more if I make you sicker. What's your thoughts on that post?
well, everybody gets paid more. I mean, that's the whole idea
It's
is,
an inverted system.
no, it is. It is. I used to think that the insurance companies were the stopgap, right? That they don't want to pay out their premiums, but it turns out most insurances are reimbursed as a percentage of what they pay out, not a percentage of the premiums that they collect. So
So there's
even
no
the
ceiling at all.
no, there's nobody to restrict it. No, this is
Yeah.
always the joke on, why did you order the CAT scan? Because Medicare allowed it. That it's not that you need that particular test. It's just if you have diagnosis A, here's the list of covered services. You're back in this whole problem with insurance. Here's the list of covered services. You're going to get every single one of those tests, whether you need it or not. And as a doctor, if I'm part of most doctors are not their own boss, right? They work for a corporation. So as a doctor, if you do not order every one of those, you're going to get a knock on the door like I did from, hospital administrators going, you're not keeping up with your billing, right?
Right.
And on the other hand, if you had a patient, if you had a client where they were actually paying for each one of those tests, they're going to be going, do I really need this? Right?
Yeah.
What is this going to tell us? How is this going to change my treatment? And then you start being a lot more judicious about what you're going to be ordering. So now the whole system's backwards, and even the insurance companies, it's just backwards. And then all that needs to be reformed and changed. And I don't know if we can do that or not.
Yeah, it's a tall task, no doubt about that. Let's go back to some of these diseases and these issues. So if I'm a mother watching this right now and I've got like a hyperactive kid, and I need to go to a doctor, one of the physicians perhaps that that you've taught, what's taking place there?
Well, again, this is back to MedMAPS, just going to MedMAPS website, finding a MAPS doctor, because that's one of the things that we do. But, when you have a kid that has hyperactivity or attention deficit or something like that, these are not magical, I don't know, behaviors. These
Right.
are all based on biochemistry, and they're based on brain function. And so one of the big things you do with a kid like that is you say, okay, we need to remove everything else that might be overstimulating that brain. Now, having an ADD brain is not a bad thing. I mean, I have one of those myself. It's part of why I do what I do, right? It makes
Everybody on
me
this podcast does, yes.
right, because it makes you interested and curious, and you research and you try and find answers, and you don't just take whatever pablum they're feeding you, right? So, it's not a bad thing. It's just you have to be able to control that. You have to be able to control impulses, because they always say the biggest movers and shakers on the earth are all ADD, but prisons are full of people with ADD because they don't have impulse control, right? So but what we look at is, number one, we're going to look at toxicity, because we know that just eliminating the garbage out of food can make a difference with ADD. right? We look at that toxicity component. We look at nutrition.
Okay, hold on a second. Let me stop you there. So eliminating the toxicity component, what does that consist of?
Well, again, we're back to food. So,
Yep.
there's certain rules I have with food. Number one, it should be real food. If you get something that is packaged, you better read the label. And I have the 5-item rule or the 3-item rule. If there's more than 5 things on the label, throw it away. If you can't pronounce them, throw it away. If they have anything synthetic in there that's not food, throw it away. If they have processed or highly processed grains, throw it away. If they have, any of these seed oils, corn, soy, sunflower, safflower, canola, peanut, if they have any
I
of these.
love that we went in this direction. Yeah, I got to be honest. So this is one of these things that really sticks in my
his love
craw.
language now.
Yeah, there are.
You're Adderall. I mean, you got your choice.
Listen, you're in for it now, Dr. Neal. You said the magic word.
It would seem that there's a lot of physicians out there on the social media platforms that are defending seed oils. Like, what's your take on that?
Well, okay, because you're talking back to the corruption in nutrition research, right? So, if you have Monsanto or Conagra or one of these big corporations, not so much Monsanto, but some of the big farming
which is now Bayer, even larger.
Yeah, I know, it's even worse. But if they're the ones funding the research, if you have the largest manufacturer of soybean oil funding the research on the benefits of polyunsaturated fatty acids, the PUFAs, then you're going to want to question that. So, there actually was a study in the past where they had gone head to head, getting fats from animals, saturated fats basically from animals versus these
a true control,
oils, right? Right, a true, and this was in, I believe it was in either inmates or people in mental institutions. So they were like a very controlled group, and you could control what they were eating.
Eliminate a lot of variables.
This was a 5-year study, and there was government money involved with this. But it was run by a group that was hell bent on getting animal fats out of our diet, right? So they did the study, and what they found was the group that got the saturated fats had worse looking cholesterol numbers, but they had better outcomes. All right. So they had fewer heart attacks, fewer strokes. They lived longer. That study was never published. It was just buried because the data didn't match what they wanted. Right. And then so that was a true controlled trial. All right. So it was the kind you want. What they're publishing are population studies, right? Based on questionnaires. How many Wheaties did you eat? How many steaks did you eat? That's the crappiest. I mean, that's one step above opinion.
Yeah.
Right. And usually those kinds of studies are driven by somebody's opinion, right? And usually it's the industry, right? So, when it comes down to it, you have all this data out there about how great polyunsaturated fatty acids are, but they're not looking at, omega-6 versus omega-3 fatty PUFAs, because you want to give me DHA, I'll take that all day long. Right, that's a polyunsaturated omega-3 fatty acid. But I'm not going to be sitting there drinking arachidonic acid. That's a polyunsaturated omega-6 fatty acid. So if you're telling me that arachidonic acid, large amounts of arachidonic acid in your diet are good for you, then I don't think you've read very much that wasn't funded by the arachidonic acid industry. Right, because that's what you get from corn and soy and all those things. It starts with that omega-6, that essential 18-carbon omega-6, and or 16-carbon, I can't remember, but that's the essential omega-6, and it immediately gets converted into just like 3 steps. It gets converted into arachidonic acid. Well, too much of that is extremely inflammatory, and all the diseases of mankind, as far as I know, are based on inflammation, whether it's cancer or heart disease, any of these degenerative disorders, immune issues. Ultimately the damage is done by inflammation, and the speeds it. So
Yeah.
I'm sorry, I'm not going to be drinking corn oil. I'm not
No,
changing my mind.
listen, I'm with you. We get phone calls in here, and I recommend, dietary changes for folks. And one of the things that always comes back, they pull that stuff out, their C-reactive protein goes way down. So like that's your inflammatory, metric
Yep,
right there. That's all you
right.
need to know. I'm sorry, I interrupted you. You were on toxins. So we stopped at seed oils. I sidetracked you.
Well, no, no. I mean, this gets back to the just all the non-food things that are in food.
Yes.
Like food coloring agents, but it's not just food coloring agents. I mean, things like carrageenan. So carrageenan
Yes.
is added to foods as an emulsifier. Well, it makes everything nice and smooth and creamy, and it's
Hmm.
in things like baby formula. It's in almond milk. It's in things that
Can
people
you
would.
think of any emulsifier that's healthy? I mean,
Well,
that
no, no,
whole
no. This is what I'm
category.
saying. It's like,
Yeah,
okay,
exactly.
let's think about this. If it's emulsifying what's in the product, isn't it going to emulsify you? And our
Correct.
intestinal tract in particular. I mean, we have that lining and there's the mucus layer above it. What do you think an emulsifier does to that? Right? It's just
Right.
gone. And if you don't have that protective layer, what do you think that's going to do to your gut? And your gut lining and your gut lining influences your immune system, and that immune system creates inflammation of the brain. Back to the ADD and the autism and all that. I mean, 70% of autism, based on the data that we have, about 70% is brain inflammation. It's
So
not
step
that's
one
what's
is
causing it. So anything you can do to improve inflammation will improve your autism. It's the same with ADD, not at that same level, but brain inflammation has a lot to do with ADD. So if you can remove those things from the diet, number one
mhm,
rule, eat real food. Eat
mhm,
real
Right.
food. If you're going to eat something that's prepared, it shouldn't have more than 5 ingredients unless it's, a fruit salad or something. But, it shouldn't have more than 4 or 5 ingredients. And you should be able to pronounce everything and know what it is. And then it
Right.
should not have any non-food item. I mean, to me, it sounds so stupid. But on the other hand, what is everybody eating? Just read the label. I mean, how many non-food items are there in that food? It's incredible. And you don't think that's going to affect your brain? So that's the big thing that I'm doing with kids with ADD is looking at, do they have brain inflammation? What does their gut look like? What are they eating? How can we get that out of their system? And then you can open up that whole Pandora's box of, EMFs, electromagnetic fields and screens and, all that stuff. Because I think, we know if I put you in front of a certain frequency of red light, your bones will heal faster, your skin will look younger, you'll have less
Great
inflammation,
point.
that sort of stuff. So what happens when
mm,
you're just, all day long sitting in front of a screen, beaming blue light into your eyeballs? You know,
Right.
I'm sorry, there's going to be an issue there. And I'm not an expert at it, and I don't know what to do about it. But again, go back 100 years, 150 years, there was no EMF. The EMF was from the earth, right? Now, since radio showed up in the late 1800s, after that, there's no place you can go on this planet where you don't get EMF, right? And
Yeah.
and you sit and come sit in my truck. It's a hybrid F-150. Oh my God! I mean, I don't even take my
Yeah,
field
you're
meter in
bathing
it.
in it.
I'm bathing in it. Yeah, I just put a clip on my leg and drag a copper cable outside of my truck, and hopefully I'll ground myself.
I want to ask a question for you, Dr. New, and it's talking about gut health. And Brendan, I'd love to get your thoughts on this because I've never asked you this. But Dr. New, are you a proponent of two questions? Are you a proponent of probiotics? And are you a proponent of switching probiotic brands?
Yeah, I'm really on the fence with probiotics. I mean, the dirty little secret of probiotics is the vast majority of them, because we do 16S RNA sequencing and DNA sequencing on stool samples, so we can see every bacteria that's in there. So if you're
Okay.
taking probiotic X and I do that type of test, I'll find probiotic S in your stool sample, okay? But if you stop taking it for a week, it disappears. So, and that's almost all of them. So we really don't see colonization of the gut with probiotics. So if you're taking probiotics to change your gut ecosystem, most of them don't do that. probiotics do have benefit, but the benefit is in the signaling. So whether they're living or dead, and they've done these studies where, I can give you Akkermansia, living Akkermansia, or it's just one of the bacteria, but I can give you Akkermansia that's been pasteurized, it's dead. And you'll get
Mm-hmm.
very similar benefits from both of those products. So whether it's living or dead, there is benefit to it because the immune system senses it. And the immune system is going to change, the gut lining, the signaling, and all that sort of stuff. So there are benefits to probiotics. But again, the probiotics that I rely the most on are the soil-based probiotics, the bacillus probiotics, because these actually alter the gut ecosystem. Again, they don't colonize, but they alter the gut ecosystem to allow the good bacteria to populate the gut. And then we also use Saccharomyces, just because Saccharomyces will affect Clostridia and some of these anaerobic toxin-producing bacteria, so you're altering the ecosystem. I'm a huge proponent of prebiotics, whether it's from your food, which is the best way to get it, right?
Yeah.
Or it's from supplements, because each prebiotic will feed a different set of organisms. So like you have inulin, that'll feed all your butyrate producers and your Bacteroides. But if you have high Bacteroides, which a lot of my kids do, then we don't want to use inulin. We'll use something like the sun fiber, the partially hydrolyzed guar gum, because that'll feed all the butyrate producers, but not feed Bacteroides. So, or if you're low in bifidophilus, acacia root's really good for feeding that. So, depending on what a person has, we can try to, I'm not pretending like I can go in and increase only bifidophilus, right? Because there's going to be a lot of crossover. But I can go in and use prebiotics that are going to promote the growth of certain bacteria that I want to see a higher level of. And again, this is a place where doing the testing does help, because there's really no, I'm either doing 16 sRNA sequencing in the stool, which is cheap, or we're doing deep genome sequencing in the stool, that's DNA. The advantage of the DNA is you pick up things other than just bacteria. 16S, it's purely bacteria that you pick up with that one. But it allows you to manipulate that gut ecosystem with the probiotics. Now, or with the prebiotics rather, if I am using prebiotics, I do like changing brands, but again, I'm doing it based on testing and not just random, some random schedule that I have.
I didn't know if you just kept them on one brand for like 4, 6, 8
Well,
weeks, and then
again, if I'm using bacillus prebiotics or probiotics, I tend to use the same one. If I'm using like a bifidophilus or lactobacillus, there's enough variability between the different brands that I'll have a handful of my favorites that have people rotate through. But again, typically I'm doing 2-3 months programs. So, I'll put somebody on these things for maybe 3 months, recheck the stool, see where we're at. And again, always when we recheck the stool, I have them off their probiotics for at least a week. So I know what's, colonized rather than just what we're getting with the probiotics.
Yeah.
Makes sense.
And I definitely, I would agree with basically everything that you just said. And again, I've taken a look at the studies, but we get a lot of phone calls in here. So we, just to backtrack a little bit on my background, I was highly focused in liver health, but in doing that and in trying to improve, take people down from, their fatty liver, it was almost impossible to do without trying to positively impact their overall gut health. It's the cornerstone of all health, and it's what leads to every other issue that they have. And especially what you're talking about with trying to limit the population of gram-negative bacteria that end up dropping all those lipopolysaccharides that inflame everything and create lots of problems. My experience, at least anecdotally, with people who call in is they'll go on a probiotic thinking that this is, going to be some panacea. They do well for maybe 2 or 3 weeks and then not so much. So it's a little bit more on the repair side. And then you're right. And then changing over your diet, not necessarily incorporating. I've never been a huge proponent of probiotics from a supplement standpoint. But
right, because the body's going to get used to whatever you throw at it, right? So if you're providing it with nutrition, that's what it's used to, and that it's going to use that and run with it. But if you provide it with a specific product, then it really doesn't matter if it's a supplement, if it's an herb, or it's a drug. If you were trying to suppress something, the body will try and override that by increasing whatever the target is. And if you're trying to increase something, the body will try and override that by decreasing the target. So, it's why medications lose their effectiveness over time. And, some of these medications much more than others, like a lot of the psychotropic drugs just, they work well for a couple months and then they just lose their efficacy after that. And it's because the
Right.
body gets used to it and just accommodates. So, again, in a perfect world, we get what we need out of our food. But
Well,
as one of my 7 or 8-year-old autistic kids once told me, Dr. New, this is not a perfect world.
no, definitely not.
Right.
Definitely
So,
not.
we have to deal with what we deal with. I try not to be dogmatic with whatever it is I'm doing because, there's always this never happens, this always happens. And then you're going to find out the exceptions to both of those. So, you do have to work with person that is in front of you and how are they responding to the treatments that you're using. And so, if they're doing well with something, I may go beyond that 6-week, 3-month, whatever timeline, and then have, if they continue to improve, then I will just follow them based on how they're doing clinically. But again, some of these probiotics you can use, like I said, the bacillus-based probiotics, the soil-based
Mhm.
probiotics, in my hands at least, they have been effective over
Oh,
long
soil.
periods.
Yeah, no, I agree with you. If you're going to use a probiotic, soil-based, absolutely the best direction to go. I'll just share a quick story with you because I have a 8-year-old daughter, and this happened just this past week, where her behavior was just like so out of
Mhm.
character. Like, she'd blow up at us, not following any direction, being very erratic in her thoughts. And it's just, she's typically a like really docile girl. And, I'm a liver and gut health guy. So, my wife comes up to me and she goes, maybe we should, give her something for her gut health, which we make. This is not a promotion, but so we went ahead and did that. And within 24 hours, her behavior significantly changed. And, even for me, who handles this all the time, I had to be reminded this is the impact of gut health on, the entire body chemistry and the brain chemistry. So there's a lot of parents out there who are struggling with their kids' behaviors. And I think that I won't say it's an easy fix, but it's something that should definitely be on their radar.
Yeah. Again, our brains and our behavior, and especially with kids, because, they just don't have the ability to control their behavior the way, well, I won't say the way adults do, the way adults are supposed to do.
Yeah, right.
Where, you wake up in the morning, you have a migraine headache, you go to work, and maybe you're not the most pleasant person on the planet, but usually you do okay. You don't bite somebody's head off because that would not be an appropriate thing to do. But when you're 8 years old and you wake up with a migraine headache, you're going to bite the head off the first person that talks to you, right? So if you're eating, again, with the gut, if the gut's messed up, those toxins, and I always use alcohol as an example, right? Alcohol is made from yeast. It's a yeast
Right.
toxin, and so the toxins that are made by these organisms affect the brain. Now, they're not necessarily going to affect it in a pleasant way like alcohol, but they will agitate the brain. And then you have the whole issue of, the short chain fatty acids in the gut. Those have a huge impact on how the brain works as well. So if you don't have enough of the good bacteria making butyrate, there's all kinds of studies out there now suggesting that if there's a rat study that if you take rats that are neurotypical and you take propionate, which is a short chain fatty acid that's made by Clostridia and some of those cousins. So sorry.
It's
Um,
okay.
that, yeah, that you're going to have to edit out. If you take a normal rat, and you inject propionate into their brain, they become autistic. And again,
Mhm.
propionate is made by Clostridia and some of these fermenting bacteria, right? So these toxins do play a role in behavior. And like I said, with kids, it's going to be harder for them to control their behavior than it is for an adult. So you're going to see a lot more of that. And if you got an 8-year-old, get the job done before she turns 12, my friends. Okay?
Yeah, I would totally agree with that. Absolutely. Okay, I have another quick question for you. Parasites. What is parasites? How do they play in this? Because I was reading something just the other day, and they're like, oh, they basically profiled all of these mammals, of course, of which we are one, and they're like, all of these mammals, they typically, especially on a farm, they'll go through cycles where they treat them for parasites. We don't do that really as human beings. Is this a problem or what?
Well, we've got two elements here because there's the positive and negative parasites. So number one, there are human parasites that we're designed to have
Mhm.
that can be a problem, but usually are not. There are
Symbiotic
parasites.
organisms?
Yeah, I think they are.
Sure.
Yeah, symbiotics. So, and we know that, if you go and look at places in the world where there are parasites, what you don't see is a lot of autoimmunity. So that the
Mm.
parasites somehow provide immune tolerance to things and prevent autoimmunity. And, you can go to places like India where parasites are very common, and the people that are of means will treat themselves a couple times a year. They actually deworm themselves, spring and a fall clean out. They're the ones that get the autoimmunity. The people that can't afford those treatments and get the parasites, they tend not to have the autoimmunity. So there is
That's interesting.
some benefit to certain parasites. But the flip side of that is parasites can also be like an imbalanced ecosystem, create toxins, create irritation, and to piss off the immune system and add to the inflammation. And those are the parasites you want to treat. It's really hard to diagnose. I mean,
Yeah.
our
Mhm.
ability to diagnose parasites is just terrible. And part of it is because, most of us are not malnourished. And so the parasites aren't going anywhere. So, if you do a stool sample
Yeah.
looking for parasites, why would a happy parasite leave the gut?
So
So you're
yeah.
not sure to
If you're not
find it.
malnourished, neither is the parasite.
Right, the parasite's happy,
Yeah.
they're fat
Yeah.
happy, they're sticking where they're at, and so
Right.
the only time you're gonna see something is if you see the eggs, the ova, from the parasite, and they're not continually passing that. They're gonna pass that, at certain times of the month or during
Right.
certain reproductive cycles or whatever, because that has to be timed, right? If you're gonna, be releasing reproductive parts, you want that to interact with other reproductive parts, and if that's not happening at the same time, then you're just wasting your reproductive energy. And so these parasites have to somehow coordinate their reproduction. So, again, if you don't do a stool sample at the right time, you'll miss it. Because
Yeah.
they're not leaving all the time, they're not reproducing all the time, and that's what we look for when we do stool samples. Now, there are with the age of PCR testing, it's much easier to it's much easier to pick these things up. But
Mhm.
the trouble with PCR is you have to know what you're looking for, right? It's a yes, no question. Do you have
Mhm.
X in there? It doesn't say what's in there. It just tells you, do
Right.
you have this? Do you have this? Do you have this? So most of these stool samples, tests that we do might have 15 or 20 PCR probes. But again, if you have something that's not one of those 15 or 20 organisms, then you're going to miss it. So sometimes we will do this just based on symptomatology. And again, there's always the clinical trial. And, again, it's really a question of what's going on with the person and is it worth going down that road? I think there are a lot of people that do have undiagnosed parasites and treating them can make a difference. But again, most of the time we're treating empirically.
Mm.
Mhm.
We're not treating based on a test. So.
Yeah, that was gonna be my question is, like, what does a patient present with when they think they have parasites? Or have you seen any correlation with symptoms? Someone
Well,
comes in and say, "I have parasites," and you test
yeah.
them, and then it's like,
Yeah, I mean, the
no, you
one.
don't got that."
Yeah, so there's a couple of things. I mean, number one, if I've got a kid with just that has weird rashy skin stuff, I'm going to worry about that. If I've got a kid that had a change in their demeanor and their behavior, I'm going to worry about it. There is a blood test called eosinophilic cationic protein, ECP. So, that should be low. It depends on the lab. It's either less than 8 or less than 15. But if you have a high ECP, then something is driving up the eosinophil. So either you have something like a high grade allergy or you have parasites, right? Now, it doesn't tell you what
Mhm.
the parasite is, right? And so some people, and I've done this with my patients as well, is, if you're going to empirically treat parasites, there's all kinds of parasites. So, we tend to start big and work our way down. So we'll treat tapeworms because they tend to be the biggest of the parasites, then the roundworms, hookworms, whipworms, and then protozoans, which are the smallest ones. Because even tapeworms can be infested with protozoans. So, you don't want to treat your protozoans first because you could have reservoirs in the worm family. So that's how we do it. We'll do it medically. The nice thing about a lot of the herbal parasite cleanses, they tend to cover all of that stuff.
Yeah. Yeah.
So
it's multiple ingredient.
Right. ECP is one of the things that I do like using. And again, the idea is what happens with the patient. Do they improve? Because we deal with, we call it PANS, right? The pediatric acute neuropsychiatric syndromes, where these kids will just suddenly have behavioral changes like overnight, and it's like the devil visited the house and inhabited their soul, and now they're just they're screaming, they're angry, they're banging their head, they're putting their fists through the wall, that sort of stuff. Whereas, a week before they were perfectly fine. So anytime you have something like that, we're looking at toxins, we're looking at infections, we're looking at bacteria, viruses, parasites, so that's a place where, we do an ECP, and if it's elevated, then you do some sort of parasite cleanse. But it's a difficult topic because, again, we don't have good testing for it. And then if you're going with medications, I mean, it's hard to even get antiparasitic medications in the U.S.
Yeah,
right?
we noticed.
Yeah.
Over the past 4 or 5 years, it's been really tough.
All of a sudden, you go to jail if you write a prescription for ivermectin for something other than a rosacea.
The I word,
right?
He said it, Brendan.
Right. And mebendazole, which, mebendazole is FDA approved in like 1983 or something like that.
Yeah.
I mean, I used to be able to get a compounded because no pharmacy carried it, right? It's for hookworm and roundworms and that sort of stuff. No pharmacy carried it, but I used to be able to get it compounded, $7,500. And then the FDA granted an exclusive license to some company. They're charging $600 a pill. It's like, are you guys out of your minds? But that's where we're at. Whereas you can go to Mexico, you can go to India, you can go to any third world country where parasites are common, and, you can get mebendazole for pennies.
Right. You mean where it's made?
Yeah, exactly. Go to the factory where it's made, or they ship it to us.
Higher need for it in those third world countries.
Yeah, and I've heard the argument from some folks that, we're talking about third world countries versus first world, and obviously their diets and their nutrition are completely different. As you talked about, like we're heavy into toxins. We've got the emulsifiers, we've got all these other things in there. And there are some doctors who are like, yeah, this is sort of the perfect environment for the wrong kind of parasite, not the symbiotic. So it's probably a larger issue here in the States than it is overseas, but, very difficult to figure out from a study.
Right.
But at any rate, is there anything that as a viewer, if they're watching this and they have a child who has, some issues that we have not covered that you might want to hit before we leave?
Well, again, there's always the genetic component to consider. So, when you start getting histories from these kids, from the parents, what you'll find is there's either autoimmunity, and remember, most people with thyroid problems, that's an autoimmune disorder. It's not a thyroid problem. Most of them have Hashimoto's thyroiditis, so they make autoimmune antibodies that attack the thyroid. But there's autoimmunity in the family, or there's allergies, or there's eczema, or there's some food sensitivity stuff, chronic sinus issues in the family. So that there's already a predisposition there. And then the big thing is what we've done to diet, what we've done to the health of our mothers. And, again, it's when I started my residency, pissing off the immune system of a pregnant woman was strictly forbidden. You just did not do that. Now nobody seems to care, right? It's like, oh, we can do this, we can do that. It doesn't matter. But the idea here is, if you've got a kid that has behavioral issues, if you've got a kid that's diagnosed with autism or is looking, They had words at a year and now they don't. Don't wait until they're 4, 5, 6 years old to get them diagnosed and in to see somebody. Get them in to see somebody like me or, a MAPS physician early, because the sooner we can intervene, the bigger difference we make in the kid's life. I mean, the one nice thing about pediatrics, because a lot of doctors don't like dealing with kids, because everything's more difficult. It's more difficult to draw blood. It's more difficult to do an exam, all that stuff. But the beautiful thing about kids, you change a 2-year-old's life, you've changed their entire life, the entire projection of where they're going. So if they're going to live to be 80, 85 years, you've given them 83 years of health. You change a person in their 70s or, like me, I'm in my mid 60s, you change my life. I mean, how many more years am I going to be on this planet? Well, hopefully a few, but it ain't going to be 80 years, right? So, again, that's the beautiful thing about it. But the important thing for any parent or any person, you don't have to see somebody like me to do this stuff. Start with the basics. And the basics are what you eat, the air you breathe, and the water you drink. Get the garbage out of your life. And that means, it means getting rid of carpeting. It means putting in air purifiers. It means having some sort of water filtration system, somewhere where you're going to get clean stuff into your system. And then again, with the food, if you're going to spend money on something, spend it on food. Get real food that is as much organic as you can. I like to say, I tell all my patients to buy organic because the bigger the market, the less I have to spend to buy organic produce, right?
Right, driving down the cost.
It's all very selfish. But no, I mean, as much organic food as you can. And if I'm telling you don't eat seed oils, don't eat, processed garbage, don't eat animals that are fed that. We can argue about whether people should be vegan animals or whatever, but, don't eat animals that are fed crap either, because they're just concentrated for you.
That's an excellent
I'd
point.
rather have you eat a bowl of, cornflakes, commercial cornflakes, than eat a cow that's been fed corn.
Yeah, because I tell this to folks all the time too, because if the cow is eating glyphosate-laden grains, that glyphosate is going into the meat. They're consuming that. That's going to degrade their gut health. Absolutely, and I think that's a cornerstone of overall health. Period. And you brought up something else that I thought was really a very good point, which is impacting somebody at a younger age. I cannot tell you how many good physicians I come across, really out of the box thinkers, progressive thinkers, who got to where they are because they were positively impacted by something that was initially a disease when they were a child. They overcame it and they were like, oh, this is really the way to heal. And then they end up becoming the healers of tomorrow. So it's a great point.
No, a lot of us get here because of our personal journeys. I mean, for me, it was more, what do I do for my patients that, I could see. I mean, when you see the trajectory of your life and having a medical practice where, you can't help most of the people you see, I can't imagine a more miserable existence. Right. And that's kind of what drove me into what's causing disease. What can you do about those causes? But again, the whole idea here is we have to reverse the trajectory of what's been happening with research, with nutrition, and this idea that if there's a problem, there's a pharmaceutical, because that's basically medical education now, right? It's not about what's the cause of the disease, what can we do about the cause? No, it's, if you have high blood pressure, we're going to put you on, an ACE inhibitor or a calcium channel blocker.
Beta blockers or something.
So we don't learn that fundamental what's the cause kind of stuff. And if we're stuck in that pharmaceutical model, we're just going to get sicker. I mean, that's the bottom line. Where, there's that. I remember seeing the research, the article on statins and heart disease, right? So the whole thing with statins and cholesterol, if you have high cholesterol, there's really not a lot of evidence that a statin does anything except lower your cholesterol, right? It doesn't really change anything else. But if you have heart disease, the teaching has always been, if you have heart disease or you're at high risk of having heart disease, like type 2 diabetic, then taking the statin will reduce your risk of a heart attack by 30 to 40%. The dirty little secret is, even if that is true, and this was a review article that reviewed all, I think 2019, so relatively recently, but they reviewed all these cases, all these articles on the benefits of statins. And what they determined was it may reduce your risk of a heart attack 30 or 40%, but it increases your life expectancy by 3 to 4 days. All right.
Mhm.
Right.
Dying on Monday, you die
Yeah.
on Thursday. You know, it's like, and that's because the toxicity of the drug in it eventually will outweigh the benefit of the drug. There's very few drugs that make you live longer, right? And people don't even think of that when they prescribe. Doctors, you know, certainly patients aren't thinking about it. But
Yeah.
that's the whole problem with the pharmaceutical model. If I tell you the key to health is not take toxins into your body, well, what the heck do you think a drug is? It's a
Right.
toxin.
All the RXs. Yeah, and especially with, I
Yeah.
find it interesting because statin drugs in particular block CoQ10, which we know is good for the
Oh, yeah.
cardiovascular system.
No, I always said, you know,
and it's hardly
I
ever
don't
talked
know.
about.
No, I don't know why they didn't do, you know, Lipitor CoQ10 combination. Every
Right.
statin drug
Yeah.
CoQ10 in it.
Yeah.
You
Oh,
know,
I
so-
agree. Well, listen, for the physicians that are watching out there and really any of the viewers, I know that they're looking for alternatives. MAPS is a good portal for them, and we'll have all of your contact information in the show notes.
Yeah. So it's medmaps.org is the website. It's a good starting place. You know, I always say if you've got, you know, if you have a certificate on your wall and you treat kids, then you should be a part of MAPS. So it's not just MDs and DOs. It's, you know, it's chiropractors, it's massage therapists, it's anybody that treats kids should be a part of MAPS. And it's also, you know, I always say you're going to get a better education in integrative medicine at MAPS than you will anywhere else. You know, obviously I'm a little bit biased, but you know, I think we have a great program to teach people the basics of what causes disease and what to do about it, because that's what MAPS is really all about. We need you know, I always say we're in a war, right? You know, it's the war for our health, and for us, it's the health of our kids. It's our future. You know, again, if I want to get real selfish, like who the heck is going to work and pay for my Medicare and my Social Security, right? Because it's not like they got a bank account with all the money I put into it. That's not there. But, you know, who's going to take care of my generation? And you need healthy kids, you know? So for us, we need an army of practitioners that are going to reverse this trend, because it's just been going off a cliff for the last 40 years since I've been a doctor, you know, and we need to change that, because if you look at the trajectory, everybody's going to be sick. I mean, who the heck's going to work? Who's going to be able to solve the problems of tomorrow? You know, and that's really concerning, because a lot of these kids on the spectrum, you know, when you can recover language with these kids through spelling or some nonverbal way to communicate, these kids aren't just smart, they're brilliant. I mean, they are brilliant. And these are the you know, these are the minds. I always say these are the Albert Einsteins, and we're making them all autistic. Right. And these are the people that potentially could solve these problems of the future. And we're taking them all out with, you know, garbage. And then it's scary. It's really scary.
Incidents,
so, you know,
of obesity and diabetes and autism and all of these things. We need to reverse this trend. Absolutely.
No, I mean, you know, again, if you look at the numbers, you know, asthma, and since I have 1985 as the year, because that's when I graduated from medical school. But, you know, if you look at the incidence, you know, and how much it's increased, I mean, asthma's gone up maybe 2.5-fold, you know, obesity's gone up 8.5-fold, and autism's gone up 28-fold, you know, and nobody wants to look at it. Nobody, it's like everybody at the CDC should be running around with their hair on fire, trying to figure out what's causing autism. But they're not. We're just better at diagnosing, and it's always been there. We just didn't recognize it. What the heck did we call this?
Right.
All right. I mean, it didn't exist.
Yeah. Agreed. So you've been an awesome guest. We got to have you back on. There's a lot in here, and there's other things that we could have unpacked, but I know you're short on time.
I want to talk to him about anti-aging. That's
anti-aging.
Absolutely. That one topic alone, because I'm being selfish now. Right. This is my time.
Give you a clue. Don't eat garbage, maintain your hormones, and do something you love.
Okay.
Oh, okay. Sort of the
There
same
you go.
same
Well,
recipe.
You guys are all set. Don't worry about it.
Awesome. Dr. New, thanks so much. Appreciate it. For
Yeah.
the viewers out there, if you enjoyed it, please like and subscribe, and we'll catch you on the next one.